With a story on reducing your breast cancer risk, here's our reporter, Laura Windsor.
Breast cancer can affect anyone. Each year, about 250,000 people, primarily women, will be diagnosed and about 40,000 will die from it. As we learned from Dr. Jason Cord of Desert Regional Medical Center in Palm Springs, reducing your risk of getting breast cancer is your best prevention.
Now, the first big risk factor for breast cancer in general is being female. And there's not much you can do about that. And then the second biggest risk is getting older. The average age of diagnosis is 65, and only 1% of women are diagnosed before the age of 30. So basically the first two risk factors are things you can't change. And that doesn't leave people feeling very empowered. So you got to look into the things that you can change. And in order to do that, we have to look at relative risk. In other words, if somebody doesn't do a certain thing, what kind of risk are we talking about as opposed to if they do those things? So to get kind of a baseline feel for that, I think we can look at the genetics component of it. You can say, if somebody were to have a mother or a sister, emphasis on or, then they have approximately a 2 times relative risk of contracting breast cancer over the course of their life. If you make that or into an and you make it a mother and a sister, that relative risk jumps and goes somewhere in the neighborhood of 3 to 14 times the baseline risk. And that depends mostly on how many sisters are in that and trail. Interestingly, if you make it where they both had the cancers before the age of 40, that relative risk skyrockets. It becomes 39 times. And those are the cancer families that you're used to talking about, where those genetics really come from. If a woman consumes more than 2 drinks a day, on average, her relative risk goes up to 2 times, which is equivalent to having a mother or a sister with breast cancer. So by staying at under 1 drink a day, you actually do the equivalent of not having a genetic risk if you had one. If you yourself are the smoker and you're female, 4.4 times the relative risk. So you're up in the same range as the person who has a mother and a sister with breast cancer. The effect of passive smoking is similar to the effect of active smoking, but just less severe. If you're a passive smoker, you're dealing with about 2 times the relative risk of contracting breast cancer. I usually try to frame obesity, exercise, and diet all together. And I give you kind of the summary statement. First, the facts, because the facts are the easiest. If you've gained between 5 and 22 pounds since you were age 18, then you're at 1.4 times the relative risk of somebody who didn't gain any weight. If you've gained over 44 pounds, you're at 2 times the relative risk. So that's just as bad as being a passive smoker, just as bad as drinking 2 drinks a day, or just as bad as having mom or sister having breast cancer. So that's a substantial risk. And I think the easiest way to tie together the obesity, exercise, and diet component is to understand that most of breast cancer is related in some ways, beyond genetics, is related to estrogen exposure. And estrogen is a fat-soluble hormone, and as a result, the more body fat we have, the more opportunity we have to store that estrogen and therefore prolong its effect. My best advice is if you smoke, stop. Definitely, for a multitude of reasons. Okay? If you drink, try to keep it under a drink a day if you can, at least as often as possible. Eat at least your 5 fruits and vegetable servings per day. Try to maximize your fiber intake. Replace your red meats with your chickens, your nuts, and other alternative protein sources such as soy. And exercise, exercise, and exercise. 30 minutes a day would be excellent advice for anybody. You reduce your breast cancer risk with exercise alone, depending on which study you quote, between 25% and 72% with exercise alone, you reduce your risk. And that's not really just a breast cancer risk as well. It also has effects on Alzheimer's disease and many other cancers as well. So that would be eat right, don't smoke, minimize your drinking, and definitely get your exercise in.
The greatest risk factor for breast cancer is being a woman, so be sure to get your yearly mammograms. For the American Health Journal, I'm Laura Windsor.